intercostal space mid-clavicular line, I want to palpate the apical pulse for 60 seconds. And now would also be a good time to gather the respiratory rate. Following palpation of the apical pulse, I will listen for heart noises, and in order to do this, I will start from the base of the heart to the apex, and I will want to be listening for S1 and S2 noises. S1 would be the lub, S2 would be the dub. S3 and 4 aren't something we're going to be looking for, and they're also normally associated with abnormalities. So if you do hear those, you would want to report them to the physician or the primary care provider. So I'll start auscultation of the heart noises from top to bottom, starting with the aortic valve. So what I'm looking for here is, So you're going to be looking for the second intercostal space. On her right side, at the center intercostal space, you're going to be auscultating the aortic valve. So I'm going to want to listen to the aortic valve for the whole cardiovascular phase, for the lub-dub. And I'm looking for regularity. I don't want to hear any murmurs or arrhythmias. Now on her left side, at the center, on the left side of the sternum at the second intercostal space, I will look for the pulmonary valve. I will listen for the pulmonary valve. Now at the third intercostal space, mid-clavicular line, I will listen for the mitral valve. And at the fourth intercostal space, I will listen for the tricuspid valve. Following auscultation of the heart and palpation of the apical pulse, it would be a good time to perform a breast exam. I'm not going to do that till over here, but it's important to note the importance of monthly self-breast exams to the patient and make sure that they are performing them regularly to prevent any abnormalities and also to be aware of the development of any abnormalities. So following assessment of the thorax, I will move down in systematic function to the abdomen. Now, when assessing the abdomen, I will first inspect the area for any integumentary abnormalities. Symmetry, I want to make sure that there's no distension. The skin is even, coloration is continuous, and before palpation, I will auscultate for bowel noises. And I will do this starting in her lower right quadrant and moving around in a squared fashion to the lower left quadrant. And what I'm looking for is the peristalsis in the intestine and visceral organs, and it indicates gastrointestinal or intestinal motility. It's a good indicator of healthy bowel function. It's important to note that before determining an absence of bowel noises, it's important to listen for at least 5 minutes in each quadrant. So following auscultation of the bowel noise, the abdomen, I will lightly palpate followed by a little bit harder palpate to make sure there's no tenderness. Are you feeling any tenderness?
No.
then if she tolerates the light palpation, you can move in for a deeper palpation. And you're also looking for the absence of any rebound pain. So if I were to push down and she didn't feel pain, but when I let my hand off she felt pain, it's an indicator of appendicitis, and you definitely want to seek care for that. So following palpation of the abdomen, I'll palpate for a distended bladder just above the pubic symphyses. And prior to the examination, I did offer Luba the opportunity to evacuate her bowels and void, so which definitely made for a more comfortable examination of the bowel and bladder. And I don't feel any distension here, but if the bladder is full, it'll rise, it'll be distended, and it won't be flat like you see here. So following palpation of the abdomen and bladder, I will continue down in a systematic fashion and palpate her femoral pulse on each side, so you're looking for the inguinal line. You're going to make sure that you're going to palpate each side, making sure that they are strong and equal bilaterally, and you're going to palpate for approximately 60 seconds. Now, throughout this whole assessment, I still am looking for skin. I'm looking at the skin, noting any abnormalities, bruising, discoloration, moles. I'm gonna continue down. I'm gonna note her legs. I would note if there were any muscle atrophy, note muscle tone, and there are none. I will move down in systematic fashion. I'll palpate her popliteal artery, which is just behind the knee. And I will palpate it on each side, making sure they're strong and equal bilaterally. As I move down her leg, I'm noting any color, which is a good indicator of circulation to the lower extremities. I will then move down. I am assessing her legs, making sure that there's no, again, muscle atrophy. Noting any edema. She doesn't have any, but edema does appear like swelling. It's an indicator of cardiovascular health and a potential heart failure. In the absence of atrophy, I do notice that she is quite well toned. Looks like this girl works out. After I palpate her popliteal pulse, I'll continue down to assess her anterior tibial pulse, and I will palpate both sides, making sure that they're equal and strong bilaterally. And then, working down yet further, I will palpate for her dorsal pedal pulse, ensuring that they're equal and strong, again, bilaterally. While I have her in the supine position, I will yet again perform the sensation test on her feet with the Q-tip like I did before. This is this is a portion of the circulation movement sensation test. So Luba, I am going to perform the sensation test on your feet again.
Okay.
I'm gonna touch you right here and let you know what the soft side feels like, the hard side, and then I will assess your feet for sensations, and you'll tell me what you're feeling. Okay?
Okay.
So this is the soft side, and this is the hard side. So I'm gonna touch your toes. Are you ticklish?
No.
Okay. So what do you feel here?
It's the hard.
Okay.
It's
And how about this?
this is the hard one, yeah.
Okay.
Okay.
So
is
this?
the hard one. This is the soft one.
Okay. How about this?
Soft.
And this?
Hard.
Okay, good. I'm going to switch to the other foot now. So what do you feel here?
Soft.
Yep. And what do you feel here?
Hard.
Okay, good. So this is a good indicator of her ability to feel sensations on her feet. As I move down, I'm going to continually check temperature, especially on the feet. I'm going to look at the quality of her toenails, the quality of her feet. Again, noting any skin abnormalities, cracks, wounds, corns, blisters, all of the above. Her feet are warm, and after I assess her feet, I'm going to ask her to sit up. So Lulu, can you sit up for me, please? And now I am going to ask her to perform some range of motion exercises in her lower extremities, and we're also going to demonstrate some strength exercises. So, can you straighten your legs out for me? Good, and put them back down. Now can you flex your ankles one at a time? Good. Okay, I'm going to ask you to push up on my hands. Good. Now, push down on my hands like they're a gas pedal. Good. Can you push this hand to the side? Oh, good. And this one? Good. All right. So she can perform a number of strength and range of motion exercises